Good day, sir. I am Angel Disabelli, and this is my report of my PowerPoint presentation of my disease that was assigned to me, which is the Amoebic dysentery that caused by a protozoa. Amoebic dysentery, also known as amoebiasis, is an infection caused by the parasite Entamoeba stolica, which is a protozoa. This condition primarily affects the intestines and can lead to severe diarrhea, abdominal pain, and other gastrointestinal symptoms. Here's a breakdown of the introduction pathology, or the point of entry, clinical manifestations, signs and symptoms, prevention, medication, and current trends related to amoebic dysentery. Short introduction. Amoebic dysentery is a common parasitic infection found worldwide, particularly in areas with poor sanitation and hygiene practices. It is estimated that around 50 million people are infected with Entamoeba stolica globally each year. The infection is transmitted through the ingestion of contaminated food or water containing the parasite cysto. Amoebic dysentery, also known as amoebiasis, is a gastrointestinal infection caused by the protozoan parasite Entamoeba stolica. The primary route of entry for the parasite is through the ingestion of contaminated food or water. Here's how the point of entry typically occurs. First is contamination, next is ingestion, cyst transformation, colonization, spread, and spread. Contamination. The parasite enters the human body when a person consumes food or water that has been contaminated with the cyst form of Entamoeba stolica. Contamination can occur due to poor sanitation practices such as the use of fecal contaminated water for drinking, washing food, or improper handling of food by individuals infected with the parasite. Next is ingestion. Once the contaminated food or water is ingested, the cyst of Entamoeba stolica reach the stomach and then the intestines. Third is disease transformation. In the intestines, the cysts of the parasite transform into their active form called trophozoites. Colonization. The trophozoites colonize the large intestine or colon and can penetrate the intestinal wall, leading to tissue invasion and subsequent infection. Spread. The trophozoites can then spread within the intestine, causing inflammation, ulceration, and symptoms such as diarrhea, abdominal pain, and bloody stools. It is very important to note that not everyone infected with Entamoeba stolica develops symptoms. Some individuals may carry the parasite without showing any signs of illness, while others may experience severe symptoms. Pathology. Once inside the body, the cysts of Entamoeba stolica transform into their form called trophozoites in large intestine. The trophozoites can invade the intestinal wall, leading to tissue damage and inflammation. In some cases, they can also spread to other organs such as the liver, causing a more severe condition called amoebic liver abscess. Amoebic dysentery caused by the parasite Entamoeba stolica can lead to a range of clinical manifestations. The severity of symptoms can vary from mild to severe. Some individuals may be asymptomatic carriers of the parasite, while others may experience the following clinical manifestations: diarrhea, abdominal pain and cramping, bloody stools, fatigue and weakness, weight loss, fever, and tenesmus. Diarrhea. Diarrhea is one of the main symptoms of amoebic dysentery. It is often described as loose or watery stools. The frequency of bowel movements may increase and the stool may contain mucus or blood. Abdominal pain and cramping. Infected individuals may experience abdominal pain and cramping, which can range from mild to severe. The pain is often localized to the lower abdomen. Bloody stools. The presence of blood in the stool is the characteristic feature of amoebic dysentery. The blood may be fresh and red or may appear as dark dietary tools. Next is fatigue and weakness. In some cases, individuals with amoebic dysentery may experience fatigue and weakness due to the loss of fluids and nutrients through diarrhea and the inflammatory response of the body. Next is weight loss. So prolonged or severe infection can lead to weight loss due to reduced appetite, malabsorption of nutrients, and increased metabolic demands of the body. Fever. While not always present, some individuals with amoebic dysentery may develop a low-grade fever. Then last is the tenesmus. Tenesmus is a sensation of incomplete bowel evacuation or the feeling of needing to pass stools even after bowel movement. So it is a common symptoms in some cases of amoebic dysentery. So it is important to note that these clinical manifestation can overlap with other gastrointestinal infections or conditions. So a proper diagnosis by a healthcare professional is essential. If you suspect you have amoebic dysentery or you are experiencing any of these symptoms, it is recommended to seek medical attention for proper evaluation and treatment.
So next is the sign and symptoms of amoebic dysentery. So first is frequent loose and foul-smelling stools. So infected individuals may experience increased frequency of bowel movements. So with the stools being loose and often accompanied by a strong or unpleasant odor. Next is bloody stools, which is a sign of dysentery. So one of the characteristic features of amoebic dysentery is the presence of blood in the stools. So this is often accompanied by mucus as well. Next is abdominal tenderness and discomfort. So individuals with amoebic dysentery may experience abdominal pain and tenderness, which can range from mild to severe. The discomfort is often localized in the lower abdomen. Then, dehydration. So, diarrhea, especially when prolonged or severe, can lead to dehydration. So, symptoms of dehydrations may include increased thirst, dry mouth, decreased urine output, and fatigue. And lastly, anemia in severe cases. In some severe cases, amoebic dysentery can lead to anemia, a condition characterized by a deficiency of red blood cells or hemoglobin in the blood. So anemia can cause weakness, fatigue, pale skin, and shortness of breath. So it is important to note that the severity and the combination of these signs and symptoms can vary among individuals, and some infected individuals may not exhibit any symptoms at all. If you suspect that you have amoebic dysentery or are experiencing any of these symptoms, it is recommended to seek medical attention for proper diagnosis and treatment. Preventing. So, prevent. Next is prevention. Preventing amoebic dysentery involves implementing good hygiene practices and taking precautions while traveling to high-risk areas. Here are some preventive measures. Wash hands thoroughly with soap and clean water, especially before eating and after using the toilet. So, washing hands thoroughly with soap and clean water is crucial in preventing the transmission of amoebic dysentery. It helps remove any potential contaminants may be present on your hands, reducing the risk of infection. Next is consume safe and clean drinking water. Boiling, filtering, or using water purification tablets can help. Consuming safe and clean drinking water is important because contaminated water is a common source of amoebic dysentery. Boiling water for at least 1 minute, using water filters or purifiers, or using water purification tablets can help make water safe for consumption. So, next is avoid consuming raw or undercooked food, especially in areas with poor sanitation. So, raw or undercooked food may harbor amoebas or other pathogens that can cause dysentery. Avoiding such food, particularly in areas with poor sanitation, reduces the risk of infection. So, properly cooked food is generally safer to consume. Then, maintain proper sanitation and hygiene in food preparation and storage. So, maintaining proper sanitation and hygiene in food preparation and storage is crucial. So, this includes keeping food preparation surfaces clean, washing fruit and vegetables thoroughly, and storing food at appropriate temperature to prevent the growth of harmful bacteria parasites. Lastly is practice safe sex and use protection to reduce the risk of sexual transmission. So safe sex practices and using protection such as condoms help reduce the risk of sexual transmission of amoebic dysentery. So this is especially important for sexual transmitted infections including those caused by amoebas. So by following these preventive measures, individuals can minimize the risk of contracting amoebic dysentery. This a disease caused by the parasite Entamoeba stolica. So it is important to note that these measures are general guidelines and should be adapted to specific local conditions and recommendations from healthcare professionals or local health authorities. So next is meditation. The treatment of amoebic dysentery involves medication to eliminate the parasite. Commonly used drugs include metronidazole, or this antibiotic is effective against the trophozoite from the parasite. So metronidazole is an antibiotic that is effective against the trophocyte form of amoeba parasite, so it works by interfering with the DNA and other essential components of the parasite, ultimately leading to its death. Metronidazole is usually taken orally and is considered the first line treatment for amoebic dysentery. Next is tinidazole. It is an alternative to metronidazole and has a similar mode of action. Tinidazole is an alternative medication and it is also effective against the trophozoite rather form of parasite and can be used as the treatment option for amoebic dysentery like metronidazole. Tinidazole is taken orally. Lastly is the paramomycin. So, paramomycin is a medication that is commonly used after treatment with metronidazole or tinidazole. It helps eliminate any remaining cysts of amoeba in the intestines. So, the paramomycin is not effective against the trophozoite form, but it kills Fis specifically targets and kills disease. So it is important to note that these medications should be prescribed and administered under the guidance of healthcare professionals. Under diagnosis is essential to confirm the presence of amoebic dysentery, as the symptoms can be similar to other gastrointestinal conditions. Additionally, the dosage and duration of the treatment may vary based on the severity of the infection and individual patient factors. So, always consult a healthcare professional for a proper diagnosis and to receive appropriate treatment guidance tailored to your specific situation. So, amoebasis caused the intestinal parasite Entamoeba stolica has an estimated worldwide prevalence of about 50 million people across the world developing an amoebasis infection each year, and 40,000 to 110,000 deaths. Amoebasis is the third leading parasite cause of death worldwide, so although anyone can have this disease, it is more common in people who live in tropical areas with poor sanitary conditions. In United States, amoebiasis is most common in people who have traveled to tropical places that have poor sanitary conditions. Trend. As of my knowledge, cut off in September 2021, the trend in amoebic dysentery prevention and treatment have been focused on improving sanitation and hygiene practices in high-risk areas. Efforts has been made to enhance access to clean drinking water, promote hand hygiene, and educate communities about the importance of proper food handling. Additionally, research has been conducted to develop new medications and vaccines for the prevention and treatment of amoebic dysentery. For the most up-to-date information on current trends, it is advisable to refer